Hello everyone, welcome to the month of September. Welcome to the first installations of putting Dr. G on the spot, focusing on infections that actually affects both men and women. For the first week, we're focusing on something a bit nasty, which is a type of infection. It is commonest type of bacterial infection that affect men and women, and it is called chlamydia. Chlamydia is a type of pathogens which is a bit strange because this pathogen is mandatory, obligate intracellular organism, meaning that the cells or the bacteria itself can only survive inside the cells. So therefore, it's not so easily diagnosed and it's not so easily treated if you don't really know that you have got it when you're asymptomatic. It is very common. In fact, it constitutes 55% of all the bacterial infection transmitted by sex. Believe it or not, between 11 to 20% of high-risk behavior men will have this disease, and between 3 to 7% of these men are completely asymptomatic. So the vast majority of men will have some degree of dysuria, burning sensation when they urinate, and pain, and sometimes even to the extent that it affects their testicle, causing epididymitis. And these are serious conditions that can actually cause pain, discomfort, and eventually even result in infertility. For women, again, it is affecting between 11 to 20% of sexually active and also high-risk individuals, and these are the women who have perhaps have multiple sexual partners. The interesting thing is that quite a large number of women are completely dormant to and oblivious of them having this disease. As a result, they constantly pass the infections from one partner to another, and this actually, according to the American study, showed that 9.5% of university female students actually have got chlamydia that they don't know about. The consequence of chlamydia in women is a lot more significant because it can cause pelvic inflammatory disease, can result in ectopic pregnancy, or even infertility and chronic pelvic pain syndrome. Therefore, treating them is crucially important. Sometimes screening for the disease can be a lot of cumbersome endeavor. It's because when you screen, you need to constantly put the patient through the swab test, and the swab test can be expensive. Occasionally, when the symptom is there, then the doctors may treat the patients with antibiotics. Interestingly, the antibiotics can be in a single dose to reduce non-compliant issues, and the treatment efficacy is nearly 100% with certain type of antibiotics. For the following week, we're going to talk about another type of infection, and we're going to talk about a condition called honeymoon cystitis. If you're curious, then stay tuned for next week's Putting Dr. G on the Spot.